We are tracking this story today. The U.S. will now require a negative COVID test for travelers from China, joining many other countries who are doing the same. And if this sounds familiar, it is. Similar actions were taken early in 2020 when the virus first started spreading internationally. It's happening now because China is in the process of dismantling the world's strictest COVID lockdowns, right as COVID is reportedly running rampant in China. Correspondent Kelly Beeson is here now. And Kelly, if the virus is spreading in China, why are they easing restrictions there at this time?
Yeah, that's the million-dollar question, Natasha. And you may remember those weeks of fierce protests in China. The people there fed up with strict lockdowns and the Chinese government responding by easing all restrictions other than wearing a mask. Now, despite reports of hospitals and funeral homes being overwhelmed, China isn't reporting high numbers of cases. And that is why the U.S. is now testing those coming from the country.
The U.S. responding to a lack of transparency from China on COVID numbers, and so is Italy, already stopping flights and testing passengers. 2 days ago, reporting one flight from China where 52% of passengers were COVID positive. Remember back in 2020, Italy was ground zero, ravaged by COVID, the global epicenter after it spread from China. Other countries not taking chances. Japan, Malaysia, Taiwan, and India all already tightening measures. This map showing global hotspots. You'll know China isn't among them. And that's why other countries are growing concerned. After weeks of protests over lockdowns there, the Chinese government decided to ease restrictions and has stopped reporting true numbers of cases. Reports from inside the country saying the virus is running rampant. Could it be, as we come up to 3 years since the beginning of the pandemic, we are right back to square one?
At the very start of the outbreak, we instituted sweeping travel restrictions on China.
For now, the U.S. is requiring a negative COVID test, but who knows if they will expand to a full travel ban. But do bans work? Dr. Monica Gandhi wrote a book on COVID and has questions about travel restrictions.
I don't think in this day and age that travel bans are effective for keeping COVID out of the country. And let's remember that we've had almost 3 years of COVID. There have been attempts to impose travel bans throughout the entire pandemic. From the United States point of view, the last time we did it was from South Africa during the Omicron surge in starting around the end of November. Completely ineffective. We already had Omicron here by the time we imposed travel bans. There's just too much movement, and this is simply not an effective strategy.
Now, back in 2020, by the time the U.S. banned travel from Chinese foreign nationals, there were just a few confirmed cases in the U.S. 45 other nations had already imposed travel restrictions at that point. And up until these most recent developments, most countries had returned to pre-pandemic travel and entry requirements. NewsNation has confirmed January 5th. That's the day tests will be required for travelers from China. And the new lunar year begins January 22nd, and that is usually China's busiest travel season, Natasha.
Right, January 5th. Kelly Beeson, appreciate the report. Thank you. And here now to talk more about this, Executive Director of Health and Community Education at Piedmont Healthcare, Dr. Jayne Morgan. Doctor, thank you for being here.
Thank you for having me.
Does China loosening its COVID policies reflect science and the case numbers that we're seeing in that country right now? Reportedly 37 million cases in one day last week. Or do you suspect it's primarily motivated by public pressure and the protests there?
And so I think that's a great example of going from one extreme to the other. They had these lockdowns and then they went immediately to a completely open society. And I see that's what we are seeing the result of, with these multiple cases that are hard to really pin down, trying to understand the transparency and exactly what is the caseload there in China. We certainly are all concerned. Obviously, in the scientific community, what concerns us the greatest is the evolution of new variants. And will we be able to track the genomics of those variants and be prepared for them ahead of time as we see this multitude of infections, which really is in the millions?
Do we have any information on the strain or variant that they are seeing in China right now? And should we be worried about it coming here?
And so the variant that is predominant in China is already here. It's the B7 variant in lower numbers, 4%, 6%. We still have the predominant variant of these BQ families, but the predominant variant in China is already here. And so when we...
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.